and to do the same for others. She studied at the University of Alabama, where she received a DMD degree, which is a Doctor of Medical Dentistry degree. She has 6 sisters, 1 brother, and she's smack in the middle of them. She's in the middle of all these siblings. And her mom is here with us today. Welcome, Mom. The person I'm talking to you about is none other than Dr. Alana Shields. Dr. Alana Shields will be sharing her expertise this evening with us about keeping our oral health in check. So give her your undivided attention, and may you all be blessed.
Hello. Well, thank you for such a lovely introduction. Now you know so much more about me. As if you didn't know. Well, maybe you didn't. You don't know. Okay, so yeah, I was quietly sneaking under the radar as Dr. Shields. I know Pastor was flabbergasted when he found out. So, yes. Well, today, that's what we will be talking about. I'm going to give a little excerpt on how to be healthier today, and starting with our oral hygiene today. So, if we could get our presentation going. I can't tell. Is it up? Not yet. Okay. While we're waiting on our technical team, a lot of people don't know that a lot of our general wellness starts with our oral care. And it starts even at a very early age. And a lot of, as we age, a lot of adults, I hear a lot in my practice, oh, I never knew. No one taught me. When I was a kid, my mom or we didn't have, these are some of the things that I hear a lot in my practice. And unfortunately, it is true, especially in, I want to say third world countries, but even here in America, if you don't know and no one teaches you, how will you know? And that's part of, many initiatives that we as the healthcare profession, especially in dentistry, need to really go forth and drive is education. If you don't know, then you won't do it. And it starts with the youth. It starts with little 5-year-old me, Part of the story was that when I was 5, I went to the dentist, and it was the dentist that gave me my very first piece of mail addressed to me. It was me. My name was on that piece of mail, and that was so influential to me. I thought, hey, this is my mail. I was such an adult, like it had my name on it. It wasn't a bill. It wasn't addressed to mommy or daddy. It was addressed to me, and I felt like so special, and that was one thing. The lollipop, the sugar-free lollipop, although as a kid you don't really know it's sugar-free, you don't care, it's a lollipop, but that was something that made it special to me, and that was one of the things that made me want to be a dentist. I remember that was influential to me. So back to our presentation. So you can't be healthy without good oral hygiene. It's funny because as a young woman, a good-looking guy comes into the office. He looks young, and then he opens his mouth, and I'm like, oh, or even if he's married, he's like, oh yeah, my wife sent me here. She set up the appointment. I was like, your wife? You kiss your wife with this mouth? In my head, you don't want to judge, but in actuality, it's wow, you don't know what you don't know. It's so important to go out there and seek the information. And that's what we're doing here today. We're really going out here to give you the information. So you can't be healthy without your oral health. Imagine you're running down, you're running a 5K every morning, and you're eating kale salad, but you have buildup on your teeth this big, and then you suffer a heart attack. How does that happen? Because they're actually linked. And we'll get into that later in my PowerPoint. Okay. So, next slide, please. All right. Why is your oral health important? Because your oral health is connected to your general health. Your oral health impacts your everyday life. It affects your speech, your smile, your ability to taste. Obviously, if you don't have any teeth, you can't chew, right? If you can't eat salad, if you can't rip the shreds of lettuce, right? So you can't eat healthy foods. If all you can do is eat soft foods, then you have to gum down the bread. You know, you dip it in your tea and you kind of just gum it down. It's harder to eat healthier foods if you don't have teeth. And if you can't, you know, if your tongue is coated with plaque, how are you going to taste it? You can't really taste it. It affects your speech. If you have, you know, gaps here in your teeth because you've had to pull so many teeth, then, you know, you're whistling, you know. So these things affect us. Moving on. So let's talk a little bit about anatomy of a tooth. As we can see, we have a nice big white tooth, and then we have the inner workings of a tooth. So on one side, we see the white layer, then we see the next layer is a yellower layer, and then we see the pink layer that has blood vessels and veins and nerves. So the top layer, the white layer, is called the enamel. That's the hard part. That's where what we chew on. That's the part that's hard. That's the part that is constantly exposed to, you know, the surroundings. That's what we smile with. That's what gets stained with coffee, or that's bombarded with sugar every day. That's what the plaque stays on. Then the softer layer is the more pink layer. That's the dentin. That's softer. That's when the cavity gets a little bit deeper, and you start to, ooh, when the cold hits it sometimes, you're like, ooh, but it goes away. Then when it starts to hurt, and you're like, man, I have to take a Tylenol every once in a while. That's the pulpal layer, and we'll see that a little bit later. Then you see the bone, and you see the gums on the outside. Okay, moving on. All right, oral disease and its prevalence. Dental caries is the most common chronic disease in childhood. Dental caries is the most common chronic disease in childhood. Although childhood obesity is, you know, giving us a run for our money, it's coming up next, but the most common chronic disease in childhood is dental caries. And you'll see in my upcoming slides as why. 50,000 cases of oral cancers are diagnosed annually in the U.S. So cancer is one of the top common killers, you know, right up there with heart disease. But cancer and oral cancer, 50,000 cases. And I'll show you some common cases of oral cancer. And as a dental provider, it's so important that I'm screening. And I'll give you a story about that too. Periodontitis, or gum disease, affects about 50% of the U.S. adults. And tooth decay can be prevented. And we're going to go into all of these in a minute. But the most common chronic disease of childhood is the next topic we're going to talk about. So we're going to move on. All right, caries. So caries, cavities, and decay. Anybody know the difference? No? You know, I got some little trinkets here. If anybody can give me the difference between caries, cavities, and decay. Anybody? You could just guess. Okay, yes. They're the same. They're basically synonymous. Caries, cavities, and decay. They can be exchanged equally. So caries, cavities, and decay. Cavities occur basically when the bacteria, so we have bacteria in our mouth. We have good bacteria and bad bacteria, and they're imbalanced with each other. When the bad bacteria overcome the good bacteria, kind of like what's in our stomach, right? When we get stomach problems, kind of in a similar manner. The bacteria on our teeth metabolize sugar that we eat. It metabolizes the sugar and secretes acid. The acid is what demineralizes or weakens our teeth, the enamel on our teeth, and creates cavity. In like pediatrics, we'll say the bacteria poops acid on our teeth, creates a hole, and that's caries, okay? But it's kind of, it gives you a visualization. And you think about it, you're like, I don't want a bacteria pooping acid on my tooth, so I'm going to brush it off. And if you think about it like that, you're more inclined to brush. So a continuous acid attack causes the enamel, the white hard layer of the tooth, to break down. So it's important, for example, I don't know if you've ever been told, it's okay to drink coffee, it's okay to drink sugary drinks. Have you ever been told that? No. But if you're gonna drink a Coke, is it better to drink a Coke once, like with your lunch, or is it better to drink it throughout the day? Once. Who said it? Once. Drink it one time. It's better to drink it once, and then after you drink it once, drink some water behind, rinse it. Because what you're doing is neutralizing the acid behind the Coke. The Coke is terrible for your teeth. One, obviously the sugar, but then it's very acidic. So it's demineralizing your teeth, and then it's also giving you sugar. It's giving that bacteria food to eat and poop on your teeth. And then it's also demineralizing your teeth. So it's like a double whammy. And then at least you're rinsing your teeth afterwards. So if you drink it once, bam, and then you're done. But if you're just sipping on it all day, you're basically doing this. You're just punching yourself in the teeth all day. So it's a continuous attack of acid on your teeth, okay? Not only that, how about crackers? You snacking on a cracker all day. Every minute you eating a little cracker here, eating a little cracker there, eating a little cracker there, or you're sucking on a mint. I know I like to eat a mint. I snack on mints throughout the day. I don't like bad breath. I'm a dentist. I can't go up to my patient and be like, hi, how are you today? And my patients would get up. They'd be like, no, thank you. Nope, thanks. No. Nope, this is not the dentist for me. Nope. So I will constantly have a mint. I'll pop a mint. Or they have bad breath. I don't want to smell their bad breath. So I will have a mint. At least in my mask, I'm smelling my mint. Okay? But it needs to be a sugar-free mint. So at least I am not constantly giving myself sugar. I'm not introducing sugar to my teeth constantly. Okay, so most important things. Don't introduce sugar to your teeth over and over. To introduce sugar, you're constantly feeding the bacteria. Okay. So cavities can happen at any surface of the teeth. How many surfaces of the teeth do we have? 3. This one's a little heavy, I don't know. 3, right? The enamel layer, the dentin layer, the pulpal layer. Okay, the enamel layer is a hard white layer. The dentin layer is a softer layer. The pulpal layer is where your nerves, your blood vessel, and your nerves, veins, and blood vessels are. Okay. So your saliva actually acts as a natural defense to repair your enamel or to protect your enamel, to protect your teeth. That's why it's important to constantly be drinking water. It allows you to secrete saliva and protect your teeth, okay? You ever been to the dentist and like, do you suffer from dry mouth? You ever have dry mouth? You have dry mouth? Because these things are protective, right, okay? And if you do suffer from dry mouth, they'll say, oh, well, you can suck on a candy. You ever heard of someone say, oh, suck on a candy? But we don't want sugar mints. We want sugar-free mints or xylitol mints. So they're the kind of mints that help protect our teeth because they don't have sugar, okay? Not like Splenda, right, because we're all like, oh, that's the cancer type of sugar-free one, xylitol. Those are good. All right, next slide. Okay, here we go. This is important because I was actually having this conversation today. This is important to show you the progression of the caries or the cavity or the decay, okay? So you have enamel caries, you have dentin caries, you have pulpitis, you have periodontitis, okay? So in your enamel caries, you have a small cavity. And that's when you go to the dentist and you're like, oh, you have a cavity, it's about $200. You're like, $200? And you leave. And then you come back 2 years later. They're like, oh, you have a cavity, it's $400. You're like, psh. And then you come back to the dentist a little bit later. They're like, oh, it's $700. You're like, what? It was $200. This is what happened. And I'm not advocating that you should give the dentist all your money. Because, in fact, I've always said that I'm probably going to be the only broke dentist you have because my goal, my purpose in life is to serve my community, right? And so I intentionally will like, oh, no, I got that one for you. Don't worry about it. Even though it can be, and I hope this is not, I mean, it is being recorded, but my goal is to help people. So I will intentionally leave surfaces off the fillings. But this is what happens, right? You start with a small enamel cavity, and then it gets into the dentin layer. And then that's when it's not hurting you, you know? Like they're small enough to not treat because it's not hurting you. You're like, oh, I have a cavity, but it's not hurting me because it's not into the pulpal layer where it's not being affected, it's not affecting the nerve. This is important because what happens is, and the reason why I'm spending time explaining this to you is because, again, you'll go to the dentist, and the dentist will say, you'll have a cavity, and you'll say, but I'm not in pain. It's not bothering me. I'm not going to bother it, you know. If it isn't bothering, I'm not going to trouble it. But this is why, because it's not into the pulpal layer. And it's also not expensive to fix, or not as expensive as if it is in the pulpal layer, because it's not hitting your nerves yet. Okay. When it does get into your nerve, that's when they say you need a root canal. Root canals are like $2,000, especially if that dentist doesn't want to do it. If you got some funky looking nerves, they do one of these things, or they're in a molar, then they're going to say you need to see a specialist. And a specialist means big money. So then periodontitis means around, you got inflammation, peri meaning around, Dontitis, meaning tooth. So around the tooth, you got inflammation. So as you can see here, yep, and then, yeah, exactly, you got an abscess. You got an infection around the tooth. The decay has gotten so far into your tooth that now you have an infection. Then they put you on antibiotics. And as island people and as Adventist people, we don't like taking antibiotics. We're like, no, I'm just put some garlic on it. Yeah, no, can't do that. You need the antibiotics for this one, okay? Because then it doesn't go away. And I was raised in a holistic household, so I am one of those people who was like, I put clove oil and garlic on it. And did it go away? No, because you have to get rid of the source of the infection. Does it help? Absolutely, absolutely. Because I was raised in a holistic home, I know it has its place, and it absolutely does. But you have to get rid of the source of the infection, okay? So you do have to go somewhere for the doctor to get rid of that infection. They got to go and clean that out. Okay. Any questions so far? No. Okay. So, what is the third layer, the most inner layer of the tooth? Here you go. All right. All right, next slide. All right. The most common cause of childhood disease is caries, right? This is what it looks like. You ever seen them little bad babies? I shouldn't call them bad, but those little babies that run around, their boogers just falling through their nose and their diaper is hitting the floor and they're just screaming and they're running around. And you smile and you see their teeth black and they look like that. It's probably because mommy put them to bed or daddy put them to bed or grandma put them to bed. Somebody put them to bed with the bottle. And it's called baby bottle mouth syndrome. This is what it looks like. And because of lack of knowledge, we perish, right? Lack of knowledge, we perish. This is what it's called, tooth decay. You put the baby to bed with a bottle full of sugar, full of milk. This is what happens. The teeth decay. Because what are we doing? We're basically feeding the bacteria just constantly, all night, every night, over and over, right? And because they don't know, again, they're not cleaning the teeth. I heard it. They're not brushing. So as a nurse, I used to also be a pediatric nurse. When I was in dental school, I worked as a pediatric home care nurse. And I used to take care of little babies that were very, very sick. They were on ventilators, like they would have a trach. They were on ventilators, and we had to do oral care on them. And a lot of times they had genetic, abnormalities. And so they would have really jacked up teeth. And even their siblings who were, genetically normal, their teeth would be looking like this. And I would try to educate because I was in dental school. And their parents would be like, they're going to get new teeth anyway. I was like, no, ma'am. That's not how that works. Because in actuality, and I'm saying this because maybe somebody's watching who does think like this, is that even though you are going to get new teeth, what's happening on the surface will affect what's happening below the surface. If you're getting an infection on the teeth that's showing, the baby teeth, the infection can damage the big teeth or the adult teeth underneath. We are actually born with all of our teeth. Everybody's born with all of our teeth. And then as we grow, they develop. Yes. So your 20 baby teeth and your 32 adult teeth all in your head when you grow up. You can actually be born out of the womb with teeth. They're called neonatal teeth, and they actually pull them. So that's a trivia point for you. Now you can show up when you go to game night. Like, look, okay. But in actuality, yes, you can damage your adult teeth by not taking care of your baby teeth. So it's very, very important and imperative to take care of your baby teeth. All right, next slide. Yep, another look at what baby bottom mouth syndrome looks like. Yep. Okay, next slide. Okay, so you can see what it looks like. So here are some cavities that look like what it looks like in the front and what it looks like in the back. Cavities. I have maybe seen some cavities like that in the back. I think I just recently filled one of my cavities in the back molar that looked like that right in dental school. I had one of my classmates fill one of those for me. So you can look. And I encourage people, it's funny how many people don't go in the mirror and go like, and look around. You really need to. Look around. Look into your mirror. When you brush, don't just like real quick in the morning and be gone. Look around. That's what cavities look like. It's brown, black spots with holes in them. Get the end of a toothpick. See if you can gut in there. Food is getting caught in there. That's probably a cavity. All right, next slide. All right, oral cancer. Oral cancer. Yes, this looks like oral cancer to me. White, fuzzy, the side of a tongue. Oral cancer. A lot of Adventist people don't smoke, but some of us do, or we used to. Smoke weed, vape, the younger generation. Yep, we can get it. Some people used to pocket nicotine. A lot of young people I see putting nicotine patches under here in their lips and under their tongue. This is what happens, oral cancer. And sometimes it has nothing, sometimes you can get oral cancer and it not be nicotine related. You can have a genetic predisposition. So, this is what oral cancer can look like. Look inside your mouth. Move your tongue around. Next slide, please. Here are the symptoms of cancer. Ulcers that do not heal within 3 weeks. A lot of times I will do an oral cancer screening. First thing I do is I will stretch my patient's skin. I'll let them know. I'm going to look at all your tissues. And I will pull their lips behind their head. And they'll be like, oh, my gosh, what are you doing? And I'll let them know I am doing an oral cancer screening. And they're like, I don't have cancer. It's like, yeah, I know, because I looked. I'm checking. And this cancer is actually a smokeless cancer. So that person is a vapor and got cancer. All right? Patches, red and white in your mouth, or lumps, unusual lumps or swelling. Okay? 50,000 cases every single year in the United States. 4 in 5. Okay. This month, actually, I had a patient that called me. I saw this patient, and I was like, this looks kind of funny. I'm going to take some pictures, and I want to see you in 2 weeks. That's kind of what we do. You see it says that do not heal within 3 weeks. I said, I want to see you in 2 weeks. 2-week follow-up is what we typically do in the industry. We say, all right, in 2 weeks, if it doesn't show any improvements, any healing, any reduction in size, then we would have you do a biopsy. He called me back. He said he got scared. He was like, yeah, I was getting suspicious, so I just went ahead. Turned out to be cancer, stage 1. Got it removed. He was like, I'm so thankful. I had to go and get surgery, but I got it removed. I was like, look at that. Save somebody's life. Dun, 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 dun. Like, you see, you never know. You never know. This is why it scared me, because, like, what if I had gotten slack? What if I was busy? What if I was, like, running between patients or something, and I just skipped a step? And you see, you never know. And I just thank God. So be diligent. Don't grow weary in well-doing. So next slide. Yes. So the question was, if I have a permanent dentist and I'm not sure if they are doing an oral cancer screening, can I ask them? And absolutely. The worst they could say is, oh yeah, I did it. I do it all the time. I do it without even you knowing it. That's the worst that can be done. Maybe they might be a little offended. Like, oh, don't tell me how to do my job. But I wouldn't be offended. I'd be like, what you know about oral cancer screening? Okay, go ahead with your bad self. That's how I would feel. But I think that I think that we individually, especially as Black and brown people, need to be advocates for ourselves, especially in the healthcare field. So the only thing that you should be doing is being your own advocate. Like, you should be saying, are you doing an oral cancer screening for me? Like, that, I think that's absolutely correct. You should be able to say, are you checking? Have you probed my gums? Have you done this for me? I think you should, absolutely. All right, periodontal disease. Okay, so periodontal disease or gum disease is what we will say, oh, you have gum disease or you have periodontal disease. This basically means you have, and I really am trying to put this in a delicate way. You have been brushing, maybe, or you haven't been brushing, and maybe you have not been doing effectively. So plaque has been left on your teeth. Maybe you have missed a few cleanings. You haven't been flossing. And so plaque has been left, that soft, fuzzy stuff. That's plaque, okay? Plaque is the soft, fuzzy stuff that you haven't brushed off. You know, you missed a few days, maybe. I don't think anybody should be missing a few days, but you miss a night, you know, you're tired, you're already in the bed, you're like, I'll get it in the morning. And you wake up in the morning, you're like, you feel that fuzzy stuff. And then maybe you got up real early and you just went, and then like your midday, like, you're like, okay, I missed it this morning, but I'm gonna get it tonight. Don't miss it that night. Don't miss it. So that, what happens, it hardens, right? Because that bacteria forms like a pod, right? The bacteria come together and they're like, yo, we got it. She's gonna come for us with that toothbrush, and we gotta stay strong. So they form calculus. We're gonna form calculus. We're gonna stay hard, pellicule, and it forms tartar on the teeth, and you can't really tell, and you can't brush it off. That's what you go to the hygienist for. Go to the hygienist, because you can brush over tartar. You can brush over tartar. And so you'll be brushing, you like thinking you're doing a great job. You'll even floss. You'll floss right over tartar. But your body will be like, this is foreign. I know. I see you, bacteria. I see y'all, and I'm going to get you. And your body tries to get it and sends, your white blood cells and sends all the cytokines and everything, sends all your inflammatory system at it because it knows it's foreign, and causes bleeding gums, causes bone loss, gum recession, and you end up looking like that, right? So you end up with, first, like initially it's just gingivitis, then a little bit of early periodontitis, then it gets moderate, and then it gets advanced. And then your teeth just start flapping in the wind, they start moving, they're a little shaky, and then you lose them. And you end up like that guy, right? Where you see more root of the tooth than the actual tooth, and your gums kind of come back here. You see them. And that's advanced perio. So when you go to the dentist, if you're fortunate, a lot of people aren't fortunate enough to go to a dentist for them to say, you have periodontitis, or you have gum disease. And to say, you know what, it's okay, we can fix it. We can clean it. So on the x-rays, what you would see, this is live pictures, these are the x-rays. You'll see these black triangles here, right? You'll see the black triangles where there's bone loss, okay? So what you do is you get your teeth cleaned. You'll see the dentist, and if you're a dentist or your hygienist, a lot of times, and as a dentist, I'll be real, we hate it. I know I do. I do not want to probe your gums because the patients hate it. That's when they stab you, It feels like they stab you. It feels like it. I don't like it because the patients hate it. But we have to check your gum health, right? Ideally, what we're doing is we're checking to see how far our probe goes down into the sulcus. How far to the bone does it go? If our probe goes between the gum and the tooth, real far down, that means you're losing bone. And that shows us that your gums are not healthy, right? Because ideally, if you're doing what you're supposed to do at home, brushing, flossing, and you're coming for regular cleanings, you wouldn't even feel it. You know, it'd be like, boop, 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 boop. You really wouldn't feel it, and you really wouldn't bleed. But when your gums are not healthy, you're not flossing, you're not coming for your cleanings, it's like, you're jumping out of the chair, you're bleeding, blood is just gushing from your gums, you're in pain, and I have to say, I'm so sorry, I'm so sorry, I'm so sorry, right? And I've seen like memes when the dentist is like, oh, you don't floss enough, that's why you're bleeding. Meanwhile, and then it's like a picture of a guy with a jackhammer on the guy. You know, it's like, okay, it's not my fault. You had to see it. Anyway, that's what's happening. Your gums are not healthy. And, you know, the age-old saying is, if you floss more, your gums wouldn't bleed. It's true. If you flossed more and you were cleaning, they wouldn't bleed. But it's not that alone. Your teeth actually have to be clean because you can floss on top of tartar and your gums, it wouldn't help. You have to get that stuff off. It's like you have to clean. You can't clean over the dirty surface, right? You have to get a deep clean all, sweep it all out, and then build on a new clean surface. All right, next slide. Yes. Okay, the question was, when you've gotten to the point where you have advanced perio or advanced gum disease and you've lost all this bone, is there something that can be done? Yes. You can go to a specialist, a perio specialist, or a perio specialist. I'm trying to think of the name. I'm blanking. But what they do is a periodontist. That's the name. That was easy. You see, a periodontist. And what they can do is they can pull the tissue back, clean it out, graft it, put it back. And they can also do a gum graft where they add gum tissue back to try and build some of the tissue back. But ideally, not really. It gives some type of aesthetic look back, but it doesn't restore back to its former position, no. You really just maintain the loss to a certain extent. So it can build back, but not much. So does that answer your question? No. Any other questions? Okay, the question was, is this better or is string floss better? Okay. String floss is the gold standard. We want you to use string floss, okay? And there's a technique to it. If you think of going to the beach and you're drying your back off, that's how you think of the string floss. So you wrap it around your two fingers, and then you make a C around your tooth. And I can't do it while I'm holding the mic. But the string floss, ideally, is the gold standard. Now, that's very difficult, especially if you're trying to get, your molars in the back. If that is going to mean you do not floss, by all means, pick, okay? So, yeah, that's basically. Use a string, but if it means you're not going to floss, use the pick. We prefer you use the pick than not to floss at all. I personally know myself. I don't use string floss. And that's coming from a dentist. Bad. Bad dentist. Okay? Bad. But I will pick, you'll find 5, 6 of these at any given time in my purse, anyone in my purse, in my car, everywhere. And I'm constantly using these. Okay? But that's better than me not flossing at all. And that's where the benefit is, okay? Question. All mouth ulcers are cancerous? No. No. And if you have an ulcer, see your professional, see your dentist about it. It could be an aphthous ulcer. You could have bit it. You could have, bit something and it developed an ulcer. That's why we typically say, see me in 2 weeks. Anything that hasn't healed in 3 weeks. You can have ulcers that are ulcerative, basically. It can be gut issues. If you have gut issues, they can cause mouth ulcers. There can be a lot of reasons to have ulcers that are not cancerous, cancer related. So usually if they don't heal within 2 weeks, that would be a reason to see your healthcare provider. Any other questions? Next slide. Okay, prevention. The next one. So the effects of gum health on your overall health. So we kind of talked about this a little bit. Heart disease and stroke. There have been many studies that link, not causative, but correlate, meaning that they can be related, mainly because of the inflammation, right? If you have high inflammation response anywhere in your body, they can be linked, right? We all know diabetes is catching everything, right? Same difference in your mouth. And I mean, intuitively it makes sense, right? If you're having a lot of inflammation, bacteria, just all kind of fungus, everything's growing in your mouth, why wouldn't it transfer and trickle everywhere else, right? It would go everywhere. There have been cases of infections that travel because your anatomy in your head, one, is very close to your brain. There are infections that can cross the blood-brain barrier right here in your head. There's something we call the danger zone right here. And a lot of island people like popping pimples. Island people love to pick face, but there's a danger zone, right? We call it danger zone number 3, that there is only veins. There are valveless veins right here that you can actually pop a pimple and it can go straight to your brain, right? The infection can go, you can develop an infection, it can go straight to your vein, your brain. So all this to say is that your general overall health, they all linked. Respiratory disease, rheumatoid arthritis, diabetes, GI, preterm, low weight babies. All these are connected. Next. So what can we do to prevent dental disease? So we talked about it. Brushing. How many times a day should we brush? I'm trying. Okay. How about flossing? Throwing floss. 2. All right. So brushing at least twice a day. There's a joke. You brush in the morning for other people, and you brush at night for yourself. Okay? Brush for your teeth and other people in the morning. Okay, so twice a day, brush, floss at least once. All right. How many times should you see? Yes, question. Okay. I think it really just depends on getting the food surfaces, getting the plaque buildup off. Okay. So if you want to brush your teeth after you eat, because people are like, oh, the mint. Okay. Ideally, just brush your teeth to get the plaque off. Okay. Because over time, it builds up. It builds up. We don't want build up. Okay. Does that answer your question? Yeah. So that's okay because you're brushing your teeth after you eat to brush off the food debris. That's okay too. Brushing off the food debris. Did everyone hear his question? Okay. Um, no, you can brush your teeth as often as you like. Um, if you want to brush 3 times a day after each meal, that's even better. After each meal is ideal. Brushing after each meal is ideal. That, like I said, one, it resets your pH, the pH in your mouth, so you're not allowing that acid to build up and allowing the bacteria to have food surfaces to poop the acid, right? Remember that, okay? So ideally, after each meal, but at base, two times a day, all right? We want to floss at least once a day, okay? Now, toothpaste. A lot of people like to say, oh, I water pick. Question. Okay. What do you think the answer is? Soft. Yes. You want a soft bristle brush. Why? Okay. Right. I heard a lot of different reasons. So, right, a soft bristle brush, a hard bristle brush can damage your gums, right? It's abrasive. It will cause gum recession and also enamel wear. Soft bristle brush will actually get underneath the gums. Okay? Manual or electric is fine. It's about the technique. Okay? It's about the technique. The technique, you'd have to see me afterwards for me to go over technique with you. Basically, you want to go at a 45-degree angle to your tooth surface. Question. Water pick is an adjunct. It is not a replacement for floss. Okay? And a lot of a lot of marketing strategy is to push water pick. But if you think about it, you're shooting water at a very high pressure right up against a wall. Where is it going to go? It's going to hit the wall, right? Okay. But you want it to get down into this crevice. You want the water to get down into the gingival crevice, right, in between the tooth and the gum tissue. So it's just going to go at a 90-degree angle. You want it to go down here. So you have to be very sensitive with your technique. So it's difficult. You can't just shoot water at your tooth. So it's very difficult to use a water pick effectively. So you have, thank you. So you have to use adjunctively. Eating healthy meals. Again, we were talking about in the very beginning, dipping your tea in your bread and gumming it down all day long, snacking on crackers. These things are gonna, Oh, yeah. Yep, dipping the tea in the bread. And then, of course, seeing your beloved dentist at least 2 times a year. Okay, these things, yes, every 6 months. For some of us, we need to see our hygienist 3 times to 4 times a year, but at least, okay? I have some of these floss picks, if anybody wanted. Let me see. Quick question. Quick quiz for my last goody. Um, should it be a difficult one? um, mm, I can't think of one. Question. Oh, okay. Okay. Um, any toothpaste. Okay, so this is again. I kind of alluded to this being. As long as it's not abrasive. So like a charcoal toothpaste, a lot of people want to move towards a healthier toothpaste, something without fluoride, something like charcoal based. Um, charcoal is very abrasive, and we want to protect our enamel, right? So, no charcoal because it's abrasive. Something that has very large granules, like a charcoal, is too abrasive, and we don't want to wear down our enamel. Something like baking soda is also somewhat abrasive. It has smaller granules than charcoal, so that's a little bit better. Personally, what I use, I don't use a fluoride toothpaste. I use nano hydroxyapatite, which is actually what our teeth are made out of, hydroxyapatite. So I use hydroxyapatite toothpaste, which would replace what's missing out of my teeth, my enamel. You can ask me later, and I'll tell you what I use. Um, that's what I use. Hydroxyapatite. Yes, hydroxyapatite. Okay. Any other questions? I think that sometimes people do say they feel a hard brush gives. Okay, so the question was, sometimes I don't feel like the soft brush is clean. I don't feel clean when I use a soft brush. Brush more. Maybe brush again, like brush longer, brush more often. That would be my suggestion, as opposed to brushing with a harder brush. Because again, we don't want to damage our gums. We don't want to damage our teeth. It's better to brush more often or more frequently than to damage the gums, because we can't get the gums back. Does that help? And then with the hydroxyapatite toothpaste, I don't find that it has the strong burning minty feeling, no. So I will use like a rinse afterwards, like Listerine, if I want that mint burn. Salt water rinse is the question. Absolutely. So I tell my patients to use salt water rinse all the time, especially after I do surgery. Salt water, you can't go wrong with salt water. Salt water kills bacteria. It creates an environment that the bacteria doesn't like. So yes, you can use salt water. Yes, question. Peroxide as well. You can dilute it. Yes. Floss, brush, and you still have a mouth odor. Have you been to your dentist? Could it be that you're flossing, brushing over the plaque and tartar? Because a lot of times a patient I see and they have mouth odor, they have buildup, right? It can be subgingival, sub meaning below the gums, that is being trapped because it traps odor. One, it's bacteria, so it smells, and it's hard and holding on to it. So, and you might have decay. Decay also has bad odor. Question? Could also be gut problems, yes. Yep, could be gut problems. It could be tonsillitis as well. Your tonsils, if you have frequent infections, your tonsils can be inflamed. You can have tonsil stones, tonsillis. They smell bad. Sometimes your tonsils need to be irrigated as well. You can do that with a water pick at home. You can gargle with warm salt water. That will also break up or bring up your tonsil stones. They can also have bad breath. It could be your tongue. Not brushing your tongue can also have bad odor, can get rid of bad odor. I believe that's my time, people. You can see me afterwards if you have any other questions and if you want some more goodies that I have. Thank you so much.
Let's hear another hearty amen for Dr. Shields. And I guess we will still have to ask her to come back another time to, because she had a very interesting presentation, and we learned a lot, I hope. I know I learned some more stuff, so, and you see, you always wait until the last minute to try and ask the questions that we run out of time. But anyway, we'll bring her back again another time when we have some more time. We're out of time. Thank you so much, Dr. Shields. We appreciate you taking time out of your busy schedule to be here with us this evening, and we'll invite you back another time. God bless you in your ministry. Amen. Amen. It's now time to go into our next segment, which is our seminars. So we'll turn over to the praise team as they come forward for song service. Oh, not yet. Pray to close. All right. Let us pray to close. Father in heaven, we truly thank you for having been with us from morning until now. We thank you for what we have learned this evening, and may it help us to live a healthier life. Thank you for your many blessings. Lead and direct, guide, and protect us as we continue to listen to your words. In Jesus' name we do pray. Amen. Stay tuned.